What challenges exist in revisional GERD surgery? Imagine trying to fix a problem that was already tricky to solve the first time. That's what revisional gastroesophageal reflux disease surgery is like. When initial surgeries don't work or cause complications, doctors may suggest a second operation. But this process isn't simple. It comes with its own set of challenges that both patients and surgeons need to understand. One big hurdle is the increased risk of complications. After the first surgery, scar tissue or adhesions form. These make the area harder to work in and can cause accidental injuries to the esophagus or stomach during the second surgery. This can lead to bleeding or leaks, which may need more treatment or longer recovery times. Another challenge is that patients often feel less satisfied after revisional procedures. This is partly because expectations are high, especially if the first surgery didn't fully relieving symptoms. Sometimes symptoms like heartburn or difficulty swallowing still persist or even get worse. Managing these expectations is important for both the patient and the doctor. Technical difficulties are also a major concern. Surgeons must carefully navigate through scar tissue and altered anatomy. This requires precise skills and experience. If the previous surgery involved a procedure like a Nissen fundoplication, where the top of the stomach is wrapped around the esophagus, correcting or adjusting that wrap can be tricky. Sometimes, the anatomy is so distorted that standard techniques don't work well, and alternative procedures like a Roux-en-Y gastric bypass might be considered. Preoperative assessment is vital before any revisional surgery. Doctors need to carefully evaluate what caused the initial failure. This might involve imaging tests or endoscopy to look at the anatomy and function. Knowing whether the problem is a slipped wrap, a hernia, or other issues helps in planning the best approach. Choosing the right surgical method is another challenge. Sometimes, a simple revision might do the trick. Other times, a different procedure like a gastric bypass might be better, especially if the patient has obesity or severe reflux. Each option has its own risks and benefits, so thorough discussion with the healthcare team is essential. In the end, revisional GERD surgery can be complex but often necessary for relief. It requires careful planning, skilled surgeons, and honest conversations about what to expect. While the challenges are real, advances in surgical techniques and better preoperative assessments continue to improve outcomes for patients needing these procedures.